So let's just start by talking about what chronic pain in the United States looks like. Okay, so the data I'm going to share with you now is from a large scale survey that was conducted in 2016. So this is really the most recent large scale data we have. We actually do have more recent data that was collected in 2020, but it's hard to get a hold of. So this is what we have. And in this survey that they found that about 28.4% of adults in the United States experience what they term as chronic or high impact chronic pain. Now, what's interesting is that in this survey, adults over 65 made up for about 60% of that population. And I want to call attention to this because I think there's this misconception that chronic pain only affects older adults or mostly affects older adults. And that's true. It does affect more older adults because as we age, our bodies experience more wear and tear, and there's more opportunity for things to go, not necessarily as planned. However, chronic pain does not just affect people over the age of 65. It affects a lot of people under that age. It affects children. Chronic pain really affects everybody. And so we just need to kind of keep that in mind when we're talking about that today. Now, that same survey also found the following breakdown when we think about chronic pain and men versus women. Now, this slide's a little bit hard to read, but what I will say overall is that the survey found that chronic pain affects women slightly more than men, about 31% to 26, and they did not do a good job teasing out other gender identities. They really did not. So we'll leave that at that. But this is kind of the results of that survey, kind of broadly speaking. And then if we look at the breakdown of chronic and high impact chronic pain by race and ethnicity, again, at least the ones the survey coded for, this is by no means comprehensive, and I truly wish they did a better job breaking things down. But this is the data we have right now. They found that chronic pain is slightly more common among Caucasian individuals, followed by Black or African American individuals, then Latinx individuals, and then what they termed as other, which they're saying is everybody else, which again, wouldn't be my way of doing it, but that's how they broke it down for this survey. So that's just kind of a snapshot of what chronic pain looks like in the United States from a demographic standpoint. We also really need to, I think, give credence to the fact that socioeconomic status is also associated with an increased prevalence for pain. So, for example, this study is actually from 2011, which I realize is a bit dated, but there is data to suggest that the trend holds true. What they did in this study is they looked at chronic pain 3 months prior to the study, and they found that rates of pain were consistently higher for individuals who were below the poverty line compared to individuals who were kind of at 400% above the poverty line, which I know sounds weird, but that's a way of measuring poverty. But if you look across the table here, you can definitely see that there is this direct relationship between socioeconomic status and intensity of pain. Now, I want to point out things like neighborhood socioeconomic status can also influence other factors that have to do with pain, such as access to care facilities and access to pain management programs. Additionally, we know that for people who are living in kind of substandard living conditions or chronically stressful living conditions, that can affect treatment outcomes as well. So we have to be aware of that. That said, even when we hold socioeconomic status and all the things that come with it constant, people who are from minority and historically underprivileged populations continue to be at greater risk for disparities in pain care, meaning that they are not getting the same level of care or the same type of treatment when compared to their white counterparts. And if we're going to do work with people with chronic pain, we need to pay attention to that. So, as I was saying, there's really a lot of research to suggest that there are differences in medical decision making when it comes to pain care, and that those differences are based on things like race and gender and socioeconomic status. And can be seen really anywhere pain is seen. So, it's not just a chronic pain issue, it's anywhere there is pain, we see these differences. And that's a whole nother workshop. So, I'm not going to spend too much time on that. But I'd really be remiss if I didn't at least give it a little bit of attention today as we talk about chronic pain. So, this slide is really a summary of some findings from some really cool work that's been done by a group out in Indiana. What they do is they were doing this even before AI was a thing. They use simulated patients. And so they have like a vignette of a case study and a simulated computerized patient that is shown to the participants in their studies. The participants are usually medical providers or medical students. And so because the person is an avatar and can be kind of strategically manipulated, they just change one variable at a time. So they'll change race or gender or socioeconomic status. And what they've found is that by doing this, it changes the provider's recommendations for the patient, even though the actual clinical variables don't change at all. And so this slide just kind of summarizes those findings. We see differences in decision making for pain interference ratings, for whether or not to prescribe opioids or how much opioids to prescribe, for whether or not that person gets prescribed an antidepressant instead. And sometimes it's appropriate to prescribe an antidepressant, but this factors in whether or not there's recommendations to have accommodations at work, whether or not they get a referral to PT. And it's not on this slide, but also whether or not they get a referral to mental health or to a pain psychologist. So I just had to say that. I couldn't give a talk on chronic pain without acknowledging that. So some of you might be asking, why in the world are we in a session for mental health providers talking about chronic pain management? I hope you're not thinking that. You wouldn't be here today if you were genuinely thinking that. But just in case, I do want to point out that another fairly recent survey done by the American Chronic Pain Association estimates that about 32 million people living in the United States have chronic pain. Other estimates say it's closer to 100 million. It really just depends on how we define it. But most people would agree that about 50% of those people are also living with comorbid anxiety and depression. Okay, so there's going to be a lot of overlap with what we see in our offices. Additionally, I want to point out that in the older adult population specifically, it's estimated that about 13% of older adults will have both chronic pain and depression. So, because of that overlap, we really have to be thoughtful. And that's part of why we're here. We also need to account for the fact that it's not just mood disorders and anxiety disorders that overlap with chronic pain. We also know that substance use is highly comorbid with both mood disorders and chronic pain. And there's a great deal of evidence that suggests that just living with chronic pain and substance use increases the risk for suicide. Okay. We know there's this wonderful review article that was put out by Racine and colleagues in 2018. And in that article, it says that people with chronic pain are twice as likely to report suicidal behaviors or to actually complete suicide when compared to people who do not have chronic pain. Additionally, this is the most interesting thing to me, suicidality among people with chronic pain is not thought to be due just to the pain itself. I think there's this misunderstanding that, people are in so much pain, they just can't take it anymore, and then that's what drives them to suicide. That is definitely a contributing factor. However, the research says that it's actually the impact of chronic pain on psychosocial factors like livelihood and ability to work and how it affects your ability to engage with family members and whether or not you're able to do the things that you used to be able to do. All of those factors, which are also associated with depression and anxiety, it's that leads people to suicidal ideation and suicidal behaviors. And so, just from that standpoint alone, we need to be aware of these things.